Hi, this is Cath King, the plant-based nutritionist at Seeking Health. Prostate cancer is big news at the moment in New Zealand. In today's Herald, there are two stories on prostate cancer. One on how smoking nearly doubles the risk of prostate cancer returning after surgery, and the other encouraging men to take part in prostate cancer screening. I have issues with both those stories. Now, prostate cancer is an issue that's quite dear to my heart. My father died of prostate cancer, and so I just couldn't let these stories go without comment. In the first story, they're basically talking about research showing how poor the survival rates of prostate cancer patients who are smokers are compared to those who are non-smokers. And the whole point of the article is summed up by the lead scientist, who says, "Our study's findings underline the importance of informing a prostate cancer patient about the negative effects of smoking." Now, that's one point of view, and here's my point of view. It's not that I think doctors shouldn't be telling their patients about the risks of smoking, because I do. Or even that this research shouldn't be done, because I know how things in the realm of medical science work. Doctors and scientists require proof before they can make recommendations, even with something as seemingly obvious as the unhealthfulness of smoking. What I have a problem with is that the Herald chose to focus their readers' attention on this research, on this topic, when there is so much other research out there showing even greater links between the consumption of animal products, especially red meat and dairy, and prostate cancer. There are an avalanche of studies out there that show consumption of these foods increase your risk of not only dying after treatment, but of actually getting it in the first place. So instead of informing their readers about something that could potentially prevent them from getting prostate cancer in the first place, something most people are unaware of, and something that most people actually do every day, they have chosen to tell them about research that is only relevant to those people who already have prostate cancer, that is about something they already know is bad for them, and that relatively few people are doing. It just makes no sense to me until you look at what else is in today's edition of the newspaper. As well as ads for Pack and Save and Countdown, who probably would not look favourably at people being informed not to eat a large portion of their products. There's also articles and recipes for things like the world's largest pizza, Kiwi favourites of fish and chips, lamb chops and pavlova, and then recipes for pork schnitzel, baked whole fish, stuffed duck, because after all, isn't it duck shooting season, salmon, roast lamb, and freaky fitness foods that include crickets, bones, and brains. However, it's interesting to note that they do take issue with the growing practice of adults wanting to drink human breast milk. And they criticise this practice for being a risk to health due to the possibility that chemicals like caffeine, alcohol, prescription and illicit drugs and environmental toxins can all make it into breast milk through the mother's body. But they also criticise it as being completely unnecessary, stating that buyers are not just paying a jacked up price for something that does not offer them more of a nutritional benefit than a diverse, balanced diet. And yet, these same people see nothing wrong with consuming the breast milk of mothers who happen to be cows. The toxins that a cow is exposed to and that are passed through her body aren't seen as problematic. And whereas the breast milk of our species is seen as being unnecessary, of no nutritional benefit, and a waste of money, the breast milk of another species is seen as both necessary and nutritionally beneficial. And I realise I've got slightly off topic here, but I just couldn't let that one pass without commenting. And then we come to the second article on prostate cancer that I have a problem with. The one promoting prostate cancer screening. And many of you may be wondering why on earth I would have a problem with screening for prostate cancer, a practice that saves lives. Well, not necessarily. The science on the benefits of screening is mixed and very controversial. This is not a cut and dried case when you look at the data. The PSA test is not foolproof, and PSA levels can rise without there being any cancer present, and PSA levels can also be normal when there is cancer. Some research suggests that up to 21% of deaths from prostate cancer can be prevented with early detection, while other research shows little to no benefit. And in addition to the mixed data about whether it actually saves lives, it seems that it most definitely causes many men harm. And even in the article, doubt is raised by cancer researcher Professor Brian Cox at Otago University, who states 50% of prostate cancer detected by the screening PSA testing would never have developed into clinical disease in a man's lifetime. Unfortunately, it's almost impossible to distinguish which would and which wouldn't have. Therefore, a lot of men end up requiring treatment or receiving treatment for prostate cancer who would never have otherwise needed it. And the side effects of treatment include impotence, chronic incontinence of urine, and incontinence of feces. And even if we give this article the benefit of the doubt regarding the efficacy of screening, I come back to the same question. Why on earth have they chosen to publish an article on early detection rather than prevention? Once diagnosed with prostate cancer, you are given 3 choices of therapy for the disease when it's localized to the prostate: radical surgery, radiation, or to do nothing. Doing nothing is also called watchful waiting. Doctors like to refer to this as active surveillance. And since surgery and radiation have not been shown to save lives, active surveillance means doing nothing until the cancer returns or the PSA rises higher, and then doing treatments that would not have saved lives in the first place. Research shows a 10-year overall survival rate of 94% for men with localized prostate cancer managed conservatively, so those who did nothing. And it shows a 10-year overall survival rate of only 90% for men who were treated with surgery. But if we compare the ineffectiveness of medical treatment after early detection to eating a plant-based diet to prevent prostate cancer, we can see that men who eat meat have a 54% higher chance of developing prostate cancer, and a man's risk of actually dying from prostate cancer is 3 times lower on a vegan diet. Research also shows that men who consume 2 glasses or more of dairy products each day have a 60% higher chance of developing prostate cancer than those who consume none. This is the kind of information that can save lives. So please like and share this video so that we can begin to redress some of the unhelpful choices made by the press in New Zealand today.